All right, good morning. I do have 11 o'clock, so we're going to go ahead and get started, even though I believe we'll have more people joining us. We had quite a few register. So I do have some introductory pieces that we can go ahead and start with so we can be respectful of everyone's time. So first I want to welcome you and thank you for joining us today. So we're here today for our first Medicaid Mini, Adding Medicaid, Your Practice, Your Way. I am Jessica Emmerich. I'm the Dental Medicaid Facilitator with the Missouri Coalition for Oral Health. We have partnered with the Missouri Dental Association and MoHealthNet in order to provide enrollment, credentialing, and billing support information to dental Medicaid providers. MCOH is a 501c3 advocacy organization. We are focused on policy and systems change to increase access to oral health services for all Missourians. You can learn more about the coalition and other upcoming events by visiting our website, Facebook page, Twitter, and LinkedIn. The goal of today's webinar is to meet you where you are, considering Medicaid or already participating in Medicaid, and then support you through the process. Today, we're going to focus on the strategic business aspects of adding Medicaid to your practice. Our session will be recorded and made available on our website after the presentation. During the webinar, attendees can submit questions using the Q&A or the chat. Let's just use chat. I don't see Q&A has been activated. So please enter any questions you have in the chat box. And then I will do my best to address those, but we'll probably address most of them at the end of the presentation. So I'll do my best to keep the presentation brief and to the point, and that way we have plenty of time to address all your questions at the end. So with that, I'm going to go ahead and start sharing my screen. Okay. So before we get started, I wanted to share a little bit about why we're here. In 2022, the coalition advocated to raise the dental rates. We needed more providers participating in Medicaid. The rate increase was a great first step, but we realized there were still many barriers that were preventing dental providers from enrolling with Medicaid. So the purpose of the dental Medicaid facilitator position is to work directly with dental providers and help them navigate Medicaid, its many resources, learn more about the barriers they're facing, and then work with MoHealthNet and the Missouri Dental Association to address those barriers. So we started off by doing a survey for providers to ask what barriers they were facing, what was keeping them from being able to provide the necessary services to Medicaid participants. Through this survey, we were able to identify several myths about Medicaid and then also several issues that needed to be addressed. So among some of the myths, we did an article, which there's a link for it down here at the bottom, where you can see the full list of the questions, the myths that we encountered, and then how we addressed those. But the bottom line, what we want to let providers know is that Missouri Medicaid needs more providers to provide care for Medicaid participants, and they want you to be successful. It would not do them, it would not be beneficial for the state to have providers on board and then have several issues related to billing or being able to see those patients. They want these patients to be able to receive the care that they need, so they want the providers to be successful. One of the myths that we have encountered is that you have to participate with all the plans. So what that means, if you're new to Medicaid, Missouri Medicaid includes MoHealthNet, which is your traditional Medicaid, and then 3 managed care plans. Years ago, managed care plans were only in the central portion of Missouri. They expanded that, so now it's statewide. So participants have the option to choose a managed care plan or a MoHealthNet plan based on their needs and their locations, their preferences. You do not have to credential with all 3 of the plans. You can pick and choose which ones work best for you. You can choose to only see MoHealthNet patients or any of the combination. We'll get a little bit more into the managed care plans in our next session, which is Meet Your Payers. Another common myth is that if you start seeing Medicaid patients, you have to see everyone who walks in the door with Medicaid, which is not true at all. You do have the options to set any limitations that work for your practice. I have providers who have set limitations such as age. They're only going to see children between the ages of 5 and 10. By days of the week, they're only going to take patients on Medicaid patients on Tuesdays and Thursdays, because that's what works best for their practice. So any limitations that you need to set to make it work for your practice is fine. We're not going to ask that you see all the Medicaid patients that come in. We're asking if you can see a percentage of them to help take a bite out of the services that need to be provided. So again, here's the link to the whole list of questions and answers. Feel free to check it out. The slides will also be available after the presentation. So Missouri Medicaid has changed a lot in the years, and there have been a lot of recent changes because of this work and because of communication with providers, because we're hearing from providers about what needs to be done. So these links go to the MoHealthNet provider bulletins that list all the details about these changes. The first one, of course, we've already mentioned, is that dental rate increase in 22 that brought the reimbursement rates up to 80% UCR. More recently, we have been able to add DO-120, that's that periodic exam, to the adult limited dental benefit package. Previously, that had been excluded, while cleanings and x-rays so the occasional exam were covered. That periodic exam that would establish a dental home had not been covered. That is now included. We've also expanded coverage of silver diamine fluoride 1354. It's now available to all participants with comprehensive benefits. So that code is now available for anyone with Medicaid that has children, pregnant women, and nursing home patients. We're still working on having it added for the adults as well. Most recently, just last week, we were able to see the dental extractionization rates increased as well. Those had been left out of the rate increase in 22. There have been lots of speculations about why they were left out, but the good news is that those are now included. So we'll talk a little bit about those here shortly. So with these changes, what I want to let providers know is that MoHealthNet is listening. We have talked with providers, we've heard what the issues are, we've brought those to the attention of Missouri Dental Association and MoHealthNet. They are listening, they're responsive, and they want providers to be successful. So with the new rates, private dental practices can now be viewed as Medicaid as a financially viable funding source. So what you're going to see now is that the rates for Medicaid are comparable to commercial insurance. So here's a little bit more about those rates. So I have two charts here. So one here with the yellow. These are the dental codes, of course, a typical office fee, typical private PPO fee, and then the Medicaid rate. These are the new rates that were established in 22. And just to let you know, this is an average of several practices that we pulled information from. So this office fee may be different than yours. This PPO may be different than yours. This is an average from several private practices that we spoke with. But we want to point out that the office fee, the commercial insurance, and the Medicaid rates are all now very comparable. So while you glance through that, I also want to tell you these rates are good, but you might say, well, PPO still pays a little bit more, which in some instances is true, but here's what 80% looks like. So here I've listed a few of the codes. This is the old Medicaid rate, and this is the new Medicaid rate. So while some of the rates aren't completely up to the same level as the commercial insurance, this is a substantial increase from Medicaid. So they are really trying to meet providers where they need to be. Some of these increases are very significant, and we're seeing the same type of rate comparison on the station extraction. We'll go over that just a little bit. So one of the first questions I usually get from providers when they're considering Medicaid is, when am I going to get paid? What's the reimbursement rate? So that's always important to know. So here I put a link to the MoHealthNet fee schedule. This goes to a list. This will take you to the whole list of codes, covered codes, the reimbursement rates, limitations, requirements, the whole everything in one place. So do take your time and look through those. If you see something that doesn't look quite right or something that looks great, let us know. We love to have that feedback. It helps us know what else needs to be done and where we can go from here. So we started doing we've been about 2 years into this work, and so we interviewed some providers that we have worked with about their experience with Missouri Medicaid. So one of those providers was Dr. Kirk Quiglis. He viewed the Medicaid miniseries when we did it last year and a half ago. He went through all the webinars. He reached out to me. We got in contact, and I helped him with the enrollment process and helped him get started. So about a year and a half ago, he was at 0 Medicaid participants. He has a practice in St. Louis and one in Illinois. So now they are both enrolled with Missouri Medicaid. And I just wanted to share just a brief interview with him.
We probably see at least 50% Medicaid patients. We love the patients and the patients love us. A lot of people are grateful just to get treatment, that they can smile again. The biggest plus is knowing that you are helping people and that they appreciate it. Everybody that I came across was very helpful. There's something to be said about knowing exactly what you're going to get and when you're going to get it for the work that you've done.
And I'm sure if you have been following any of our emails, you have seen these interviews. They're also on our website. But I think it's very beneficial for you as providers to hear back from other providers about their experience. I don't want to just tell you what it's supposed to look like. I want you to be able to hear from providers what their experience truly is. So Dr. Quiglis was able to move through the enrollment and credentialing process fairly easily. I helped him with that process, and then he was quick to initiate in his practice. One thing he has said to me about Medicaid patients is that they do require some extra work when they get started because they've gone so long without care, but it's been very rewarding work being able to work with these patients. So he's definitely a great resource. I hope you appreciate his interview and take his words into consideration when considering Medicaid.
We probably see.
You really like that information. Okay, so this is my contact information. So I just want to share this up front. This is my cell phone number. Call me, text me, send me an email, whatever works best for your practice about what questions do you have? What do you need help navigating? Whether you're already enrolled with Medicaid or whether you're considering it, I'm here to be a resource. Another thing I wanted to share with you guys quickly is this website, which let me get it pulled up. So this is a website on the Coalition website where we are keeping all of the resources we are creating for dental providers. So this is where you can find all the information. These are all the news and blogs, all the emails that you see coming out with information, links to blogs. This link will get you to them. This is kind of a toolkit we've put together, just some basic information for providers. Here's that myths document I referred you to earlier, credentialing checklist. So we're putting everything here on the website because we want it to be readily accessible to you. This is where you'll also find recordings of our webinars. So go back and look through any of these that you think may be beneficial for you. So today's session, it's only supposed to be 30 minutes. So that's why I tried to keep it brief. And today is just supposed to be an overview about Medicaid. What is it? How does it work in your practice? So I think this part is really more beneficial to hear from you guys about what questions do you have about how could it work in your practice. Next week, we're going to dive into the managed care plans. We'll talk about credentialing. We'll talk about participants and which services they receive. But right now, I'm just looking for the questions about what questions do you have? What concerns would you have with Medicaid? What myths have you heard that we can kind of address today? So I'll give you some time to put those in the chat. While you do, I'm going to bring up the new dental extraction and sedation rates because those have been a hot topic. So let me find those. While you guys are thinking of all your wonderful questions. And one thing I really like about doing questions on webinars like this is because if you're having a question, the odds are another provider is having that exact same question. So they're waiting for someone to speak up and ask that. In the meantime, let me share with you the new dental extraction and sedation rates. So one of the big hopes behind increasing these rates, one of the common concerns we hear is there's not enough specialty providers. Where do I refer my patients to? So that is part of why we we really were pushing to have these rates increased because we're hoping that these increased rates will help get more of those specialty providers on board. So here is the new rates. I'll let you kind of look through those, but I can tell you that before, for a simple extraction, Medicaid was only paying around $50. So that was about the same rate as an exam, and it just didn't make sense for specialty providers to come on board and provide those types of services when their rates were lower. So we're starting to see an increase in specialty providers. We encourage you, if you have specialty providers in your office, in your area, let them know about the new rates, have them reach out to me. I'm happy to work with them so we can kind of address those barriers. So some of the bigger increases that we saw were to the anesthesia services. So I'll point these out, and we're going to be sending an email out probably early next week that will show a side-by-side comparison with these rates. It'll have the old Medicaid rate, the new rate, and then compared to a commercial insurance. But again, those are going to be averages on the commercial insurance, so don't hold me to those. Okay. Okay. I've heard that crowns aren't approved until age 16. Okay, so crowns are approved. So crowns are available to people with comprehensive coverage, which, like I said, we'll kind of dive into this a little more in a couple of weeks. But comprehensive coverage, that's going to be children, pregnant women, and adults. So they are covered for those. They do usually have, some of the codes have age limitations. So some of the crowns may only be available up to the age of 20, I believe. Let me look it up real quick while we're talking about it. The other part of your question was that, let's see, also heard that 2 surface fillings are being downgraded to 1 surface. Right. So that is something that we have heard from a couple of providers, and we hear that mostly about the managed care plans. So that is something that I'm working with MoHealthNet right now on addressing, because they should not be. Our managed care plans have said they want providers to bill for the services they're providing. One thing that we're seeing from managed care plans is they would rather see it billed out each line. So instead of a 3 surface filling, they want to see 3 lines, and break it out that way, which does take providers more time. So we are addressing that, and MoHealthNet is looking at that to see what can be done, because they should not be downgrading your codes. And that's actually one of the main benefits of Missouri Medicaid, is that they usually do not downgrade any of your codes. For the most part, the service you bill is what you'll be paid for. And they have a great payment cycle every 2 weeks. So you can actually see that cycle on the MoHealthNet website. They will show you, here's the date you submit your claims by, here's the date you'll get paid. So like Dr. Quiglis was saying, you'll know what you're going to be paid and when you're going to be paying it. So if you are also seeing this and you haven't already reached out to me with this issue about downgrading fillings, please let me know, because we're kind of keeping track of who is seeing that, where we're seeing it, which managed care plan. So if that's something you continue to see, please let me know so that I can continue to relay that information to MoHealthNet while they work on sorting that out with the managed care plans. Okay. Another question is, if you're a specialist who needs to see a patient in the emergency department or inpatient and you're filing a 1500 claim form, should you use the D code? Okay. So if you are the specialist, so I need to know what kind of specialist is that. Are you an anesthesiologist? Are you an oral surgeon? What specialist can mean a few different things in my world. Okay, so an oral surgeon, great. So an oral surgeon, you would, and you're seeing them in the emergency department or inpatient. So usually our dental provider, so an oral surgeon, you would be enrolled as a dental provider. So you would be filling on the dental claim form and you would use the D codes. And you want to use those D codes because your reimbursement rate for example, anesthesia is higher than the medical anesthesia rate. So if you are a dental provider, you can bill that dental rate for that higher rate. Does that answer your question? And I realize for some of you who are maybe new to Medicaid, this is kind of diving in pretty deep for you guys for an introductory course. So we were doing a jaw fracture. If you are enrolled as a dental provider, so an oral surgeon is typically enrolled as a dental provider, then you would bill the dental claim form and the dental codes. So your payment is driven by the type of provider you enroll as. So if you enroll as a medical provider, you would bill the medical claims to go with them. And definitely feel free to reach out to me afterwards. I'm happy to work with you through that if you're seeing any issues or have any questions about it. Okay, and Candace missed the part, the new updated fees. So yes, I'm going to pull up, what was I looking for? I got sidetracked. Oh, we were going to look at crowns real quickly. This is a little deeper than we wanted to dive today, but I will pull it up real quickly if you'll give me just a second. So the new fees, I provided links in my presentation that will show you links to those PowerPoints. And I'm going through, so I will just show you what I'm doing. So I'm using the MoHealthNet provider manual. Most of the time when providers have questions, this is my resource. This is what I go to find the answers to those questions. So you had questions about crowns only not being available until the age of 16. So here is, this is a list of all the covered codes. This is the code. This is an age limitation. So these crowns are only available between patients 0 to 20. Here's the reimbursement rate. If we go down a little, there are some crowns that don't have age limitations. And there are a few that are available to adults without limitations. So it really just depends on the code you're using. And I will say that if a service isn't covered, so say you have an adult who comes in and they need a crown, and the crown you want to provide is not covered by MoHealthNet, you can bill the patient for that. So we're not expecting providers to just write off those costs. If it's a non-covered service, you can do a payment agreement with the patient and you can charge the patient however you see fit for that. You can do a payment plan, you can do a discounted rate, whatever works best for your practice. If it's a non-covered service, Medicaid leaves that up to the provider on how they want to handle that. So you can bill the patients for that. I know that's different than some insurances. If it's not covered, you just don't get paid for it. So if anything is not covered for the participant, child or adult, whatever patient, you can set up a payment agreement for those services. Okay, let's go back and I will show you. So those links I provided, that I'll send you out the presentation later, but the links go to right here. So this is the one that came out last week. This is the dental provider bulletin. And here are the new rates for the dental extractions. And then here are the new rates for the sedation services. Candace, was that what you were asking? Or were you wanting like the whole list of rates? So these are the new rates. I'm gonna go and put the link in here. Sure. So she said she'd also like the whole list as well, which that's where we just were. That will be, so there's two ways to find the rates. We're diving a little deep today, but no one else is asking questions. So we're gonna go ahead and just jump into this. And then we'll get more in depth with this information on the next ones that are coming up. So to find the rates for services, there are two ways you can do that. The one I usually recommend is to use the dental provider manual, which is where we just were, and then go to section 5. And it lists the rates with the covered services. So it gives you all your information in one place. These rates have not been updated yet with the provider bulletin. So I'm gonna go down. Sorry for the scrolling. Okay. So like this rate has not been updated yet. The bulletin just went out last week. Before, for extractions, they were getting paid $52.29. That rate has increased. We expect them to update this manual any day now. It should be usually within a few days that they will update this. So this is one place where you can find all the rates. Another one would be to go under resources and go to fee schedule. I'll give you this link. This is the MoHealthNet resource page. If you go to fee schedules, this one takes a little bit more time, I feel like, to get to the rates that you need. So you have to agree. So we're going to use, well, it looks like that Microsoft update has affected a few of our screens. So usually, because this is an external source, and that's why you have to agree that you're going to access it. So usually you would click accept and you would be able to access the full list here. We'll go over this in the fourth session, which is called decoding the codes. That's where we'll go over participant eligibility codes, the diagnosis codes, procedure codes, all of that information. So we will dive into that. We're just not going to dive too deep into it today. Any other questions or concerns about adding Medicaid to your practice? I'm surprised there's one thing that hasn't come up that usually always comes up. So one of the things I'm usually asked about is no-shows. With Missouri Medicaid, you cannot charge for no-shows, which is one thing that providers have asked us about a few times. And really, I've had some providers say that the no-show rate is higher. I've had some say that it's not. And so what we're finding is that if you're able to really establish a relationship with that patient and talk through any issues they might be facing, follow up with them. Once you get them through the door, the first one for the initial exam, they're much more likely to come back. So yes, sometimes they are a little bit more work at the beginning, but then just like Dr. Pugla said, they're a little more work to get started with because they haven't done this before. This isn't normal for them. But once you get them started, then they turn into a great patient and they're very appreciative of the work that you provide. I do see a question about credentialing. Why does it take a long time? Which I can address that. And we will talk more about credentialing next week. So we're really going to dive into that. MoHealthNet is putting together a new provider enrollment guide, which I'm hoping we'll be able to talk through next week. But just for an idea of credentialing, so providers will enroll with MoHealthNet first because it's Missouri Medicaid. That's our number one source. And then the managed care plans are under MoHealthNet. So right here is where you have the options about what you want to do. What's going to work best for your practice. So you will enroll with MoHealthNet to get a Medicaid ID number. That does not mean you have to see MoHealthNet patients. You could say, I'm going to enroll with MoHealthNet, but I really only want to see United Healthcare patients. That's fine. Just because you're enrolled, there's no requirements on the number of patients you see. They're not going to say you have to see 10 patients a month, 100 patients. They're not going to do that. It's completely up to you and your practice who you want to see. The MoHealthNet enrollment process, we did have it down to 2 weeks because we have been trying to expedite dental provider enrollment. Fortunately, they have seen a huge increase in provider enrollment, which is wonderful, but that does tend to slow things down a bit. So they are running behind right now because of the huge number of enrollments, which is great. We're glad to have more providers on board, but it's the same number of staff processing them. So it is going to take a little extra time. In the meantime, dental providers can go ahead and start the credentialing process with the managed care plans on the same day you do the application for MoHealthNet. In the past, you had to wait for that MoHealthNet ID number before you could start managed care credentialing. We don't have to do that anymore. You can do all your applications and credentialing on one day. That way, at the end, you're kind of all done at the same time. The managed care plans typically take around 60 business days to process credentialing. And there's lots of reasons for that. They're doing their checks and balances just like you would when you hire a new staff. So yes, it can be a little tedious and take a little time, but once they have received a completed application and you can verify with them that they've received your completed application, they can backdate your enrollment to that date. So then it becomes your decision on if you want to go ahead and start seeing patients or if you want to wait until you're fully have the final letter. So that really comes down to you, and have that conversation with the managed care plans to get an idea of how long it's going to take. What should you expect? How can you plan as a provider? So the new estimated time frame. So right now with MoHealthNet provider enrollment is taking about 6 weeks, which is an increase over the 2 weeks that we were experiencing before. But like I said, we're so happy to see an increase in provider applications. And we want to make sure they're taking time and doing due diligence and making sure everyone's application is reviewed correctly. So it's understandable that it's going to take a little more time right now. We expect that that will level off in some time, but I can't guarantee what that's going to be like. But even with HealthNet taking 6 weeks, it's still matching up pretty close with the managed care plans. So regardless, start to finish, I've had providers finish the entire process in 6 weeks. I've had some take 12 weeks. It kind of just depends on how responsive you are to if they need additional documentation, if you're filling out the application completely correctly. And that's where I can help. I can step in and kind of help navigate on what do you need? What do you need to send up front and how should you follow up later? Okay, so one provider said UHC, United Healthcare, told me that they can't submit their credentialing until they have the approval letter. Okay, would you email me afterwards and just let me know because they are supposed to be going ahead and starting the credentialing process. Now, they won't have a completed application until you're able to provide your Medicaid ID number. So that may be what they were saying. So we'll talk through that after the webinar and we can kind of see what we can do there. Okay, there's a question. Will you send a list of all the doctors accepting Medicaid? So I do not have a list, but I will show you where you can find a list. Let me share my screen. And again, this is what I'm here for. I am here to be a resource and help get you this information. I don't have everything and I'm not going to claim to know all of it, but I can point you in the right direction. I can get you connected with where you need to be. So if you're looking for providers in your area, this is dss.mo.gov. This is just the basic introductory website. If you go down here to find a healthcare provider, click yes, because you're going to go to a different site. And then here you can put in, I need a dentist. I need a healthy blue. I have a healthy blue patient. And I need, let's see. Let's look for an oral surgeon. Surgeon. Okay. So I put in that information and then you put in your location and how far you want to travel. Okay. And it will bring me up a list of anyone enrolled with Healthy Blue in that radius that is accepting new patients. So this is a really good resource for providers. It's mainly geared towards participants, but I use it often, especially if you're a general practice and you're just looking for a place to refer patients to. This is a great resource for you because it provides all their information. They're accepting new patients. They're already credentialed, ready to go. You can even print it and keep it in your office. I suggest going back and updating it every now and then because we are getting more on board. But it's a great resource for providers to have on board. Okay, well, we are over the 30 minutes for this webinar, but if you have questions, I don't mind staying on and answering them. So Esther, does that help you with finding providers in your area? If not, feel free to give me an email afterwards. I'm going to put my contact information up here one more time. Any other questions I can answer today? I know today was just supposed to be an introduction, kind of a little bit about Medicaid, what to expect. Just trying to address any myths or concerns. We know that old Medicaid, if you talk to a Medicaid provider from 25 years ago, they're probably not going to have a lot of great things to say about Medicaid. And we're really trying to address those because Medicaid has changed a lot. Medicaid wants providers to be successful. It doesn't do them any good to have providers on board and then recoup payments. I mean, then participants aren't getting the care that they need. So we're really trying to connect with providers and answer any questions they have. If there are issues, which we know there are still issues with Missouri Medicaid, but if there's anything you want us to look into or try to address, we are happy to do it. Again, we partner with Missouri Dental Association and MilHealthNet. I meet with them every 2 weeks just to talk about what's going on with providers. So we would love to have your feedback if you're seeing anything in your areas, or if you have questions that we need to address or something we could do better. We're here to help. So Here is my contact information. I hope you guys will reach out to me if you have other questions or concerns. Any other questions, anything I can answer today for you? Again, next week, we will be talking about Meet Your Payers, which will be going over the managed care plans, Animal Health Net, kind of what they offer, what the differences are, and how to go about credentialing if you do choose to do so. So I hope you all join us again next week. Again, these will be recorded and available on the website if you need to go back and look at the information some more. So with that, I'll go ahead and give you guys your day back. Enjoy your Friday. Thank you for being here on a Friday in the summer. We really appreciate it. We weren't sure what the turnout would be in the summer. We know that's a busy time for several people. So I'm very grateful that you took your time to be here and learn more about this. And I hope that we can connect later and just connect and see what we can do to make this work better for you. Have a great day.